Right. So, visual phenomena, commonest form of migraine aura, probably occurs in more than 90% of patients who or people who have this condition. And the most characteristic is what's termed as scintillating or scintillating scotoma. This term was first coined by Herbert Airy in 1870, and he derived it from the Latin word scintilla, which means spark, and the Greek word skotos, which means darkness. Okay, great. So we go to the description from Airy, which is when it is at its height, it seems like a fortified town, bastions all around it, and these are colored most gorgeously. All the interior of the fortification, so to speak, was boiling and rolling in a most wonderful manner, as if it was some thick liquid all alive. And really, that's a classic description of a scintillating scotoma, and it's just incredibly impressive when you hear exactly the same story from people who have this symptom. And they always describe it as a small area in the visual field, usually on one side. Quite often when they are reading, it tends to become more apparent earlier on as compared to if they are not. And this then gradually increases in size until it affects most of the visual field. And the edges are curvilinear like a C, and there is shimmering of the edges as is depicted in the animation on this slide. And the other sort of bit on your left is the pictorial depiction of Airy of his visual aura, and it's interesting of the times in 1800s that pretty much all of the description of migraine visual aura were physicians who were experiencing them and described them really beautifully. The other feature of a migraine aura is, of course, the concept of fortification spectra, and you read that in Airy's description as well. And this was very often used and probably preferred by physicians in the 19th century because of the bastioned fortifications which are prevalent at that time. And these then changed in mid-late 19th century because rifled artillery became much more common. And the on your slide, the diagram or the photo on your left is that of again a migraine visual aura, which becomes almost like the fortification that you are seeing on the right, which is of Naarden, which is a fort in Holland. The other question that sometimes comes up, what is the difference between scintillating scotoma and fortification spectra? And probably these terms are used interchangeably. However, most historians in headache world would say that actually fortification spectra is a term which is used when the scintillating scotoma is at its peak and affecting most of the visual field. So a bit of terminology change. Now, you all know why you get a migraine visual aura, or in fact, migraine auras of any form. And the pathophysiological basis for that is what's termed as cortical spreading depression, as on these slides. On the right is taken from a cat which shares the same guide and cephalic brain that with the humans. And if you can see, this is obviously sped up in time, and but you can, if you carefully see the initiation of the phenomena, which then spreads across the occipital cortex and more on occasion. And it's important that the speed of this depression is about 3 to 5 millimeters per minute, which equates to that really characteristic time of 20 to 30 minutes that most visual auras are present for. And in my book, as I'm sure in most of yours, if you get a history of a visual aura, then the diagnosis absolutely is migraine, except for two scenarios. One is if it is persistent, when it can herald a cerebrovascular event, or if it is occurring on a repeated basis in the elderly, when you need to watch out for amyloid spells there. And that's me. Thank you.